Hi, my name is Mary Rose Gahn. I'm a professor of nursing at Erie Community College in Buffalo, New York. And we're here today, we're going to demonstrate 3 skills for you. We have Megan here. Megan Mahoney is going to do the first skill, which will be trach care and trach suctioning.
So Megan is going to first position the patient in a semi-Fowler's position, unless that is contraindicated. She will then place a linen saver pad or towel on the patient's chest. If the patient is on oxygen, she will hyperoxygenate the patient according to agency policy by turning the oxygen level on the gauge up to between 8 and 12 liters. She will then turn on the suction machine and adjust the pressure regulator according to agency policy. This is typically between 100 and 150 millimeters of mercury for adults, between 100 and 120 millimeters of mercury for children, and between 50 to 95 millimeters of mercury for infants. She will then don a clean glove and test the suction equipment by occluding the connection tubing. She'll then turn off the suction, remove and discard the procedure glove. She will then open the saline bottle and open the suction catheter kit. She'll then pour the sterile saline into the sterile container and then don sterile gloves. While both hands are sterile, she'll remove the catheter from the inner paper sleeve and hold it in her dominant hand. She will then attach it to the suction connection tubing. Keeping her dominant hand sterile, she will then turn on the suction. You always want to consider the dominant hand to be sterile and the non-dominant hand non-sterile. She's then going to place the tip of the suction catheter into the sterile container of normal saline and suction a small amount of saline solution through the catheter. She will apply suction by placing a finger over the suction control port of the suction catheter. This also lubricates the suction catheter tip with normal saline. She will then remove the oxygen mask with the non-dominant hand, and using the dominant hand, gently but quickly inserts the suction catheter into the tracheostomy tube. She will advance the suction catheter with suction off. The thumb will be off the control port, gently aiming downward, being careful not to force the catheter. She'll insert to a pre-measured length, no more than 15 centimeters or 6 inches. She'll apply suction intermittently by lifting the thumb off and on the suction port while withdrawing the catheter. She will rotate the catheter while withdrawing and does not apply suction for longer than 5 to 10 seconds. The total attempt from insertion, suction to removal should last about 10 to 15 seconds. She will replace the O2 between each pass with her non-dominant hand, which allows time to normalize respirations. She'll also rinse and lubricate the catheter between attempts with the normal saline solution. She'll repeat suctioning as needed, allowing at least 30-second intervals between the suctioning.
Right back up. Now stay down the log. Up.
She'll replace the oxygen source if the patient was removed from the source during suctioning and then turn off suction. She'll then coil the suction catheter in the dominant hand, pulls the sterile glove off over the coiled catheter. We'll then discard the glove and catheter in a water-resistant receptacle designated by the agency. She will then assess the client for the effectiveness of the suctioning, clean up the equipment, and will return the oxygen to the previous level.
Next, we will be demonstrating trach care.
So again, we're going to position the patient in a semi-Fowler's position unless contraindicated, and place the linen safe